New polling finds patients in the U.S. are now more concerned about barriers to health care, barriers they feel have been put in place by their insurance providers. 62% say someone in their household has experienced at least one insurance coverage-related hurdle in the last 2 years. 43% say their health has gotten worse because of limited access to care. So Molly Smith is joining us now. She is the Vice President for Public Policy with the American Hospital Association. Thank you so much for joining us. Can you kind of put a face to these numbers? Tell us about the real patients behind the survey results, what the most common challenges are, and what sort of impact it can have on someone's health.
Yeah, absolutely. First of all, thank you so much for having us and for really helping shed light on these really concerning practices. So, we represent hospitals and the doctors and nurses who work in them. And what we've been hearing over the last couple of years is that it's increasingly hard for them to get their patients the care that they need because of some of these insurance practices that are being put in place. So, things like prior authorization, where the patient or their doctor or nurse needs to get authorization or approval from the health plan before they can proceed with their care. We're hearing about incredible delays and lots of denials that are happening. There are also things like fail first policies where a doctor and patient, they know what kind of medication the patient needs for their care, but the insurance company requires them to first try one, two, maybe three other types of medication first. And that can really have an impact on their health and well-being. Things like getting access to rehab services after a hospitalization, or as I mentioned, getting access to your drug. Those are the types of things that are on the line. And as you mentioned, it can have a real impact on patients and their actual health outcomes.
Yeah, all I'm thinking about is how at times it can be, such a slow process just to sort of see a specialist. It could be weeks and weeks, and then to have that process slowed down even more by these, roadblocks that the insurance company puts in place. How do insurance companies explain this? What's the justification?
I think frankly, a lot of it comes down to cost.
Mm.
They, like we in hospitals, are absolutely concerned about the affordability of healthcare, and we're absolutely doing all that we can to make care more affordable. However, it cannot come at the expense of patient access to care. So, frankly, and I will say that what we heard in our polling was that actually a lot of these practices end up driving up the cost of care for patients
Hmm.
because when they can't get access, sometimes they just kind of throw up their hands and they say, "Well, I'll pay out of pocket." Or if the insurer denies their care, they end up with a bigger bill than if their insurer had helped them pay.
Well, certainly if you go through 4 different types of medication that your doctor already thinks probably won't work for you, that's a tremendous waste of money and a waste of time.
Exactly.
So then, what needs to be done to change things? I don't know, policyholders kind of taking their money somewhere else? Because often you have few options. Is this about the government stepping in? What can be done?
Both. And so the first thing I just want to say is that patients are definitely not alone if they are
Mm.
experiencing these problems. We definitely encourage patients to talk with their doctors if they're experiencing any kind of delay. Their care team can try to at least help work with the insurer on their behalf. There are also ombudsman's offices or kind of consumer complaint divisions within state departments of insurance where you can
Hmm.
go. And as you mentioned, you can always, of course, change your coverage if you have that option during an
Yeah.
open enrollment. But I just want to underscore your point about policy. We do believe that policies need to change at both the federal and state level to better protect patients. And hospitals are really working to get those laws changed to both stop these practices as well as really do the oversight of health plans that we think is needed.
That's great. It was wonderful talking to you, Molly, and it's a good reminder that both doctors and patients, you guys are on the same team and you can work together with your doctor. Thank you.
Absolutely. Thank you.